Good morning, everyone, and welcome to the WellMed Charitable Foundation Caregiver Teleconnection session. This morning we have toileting, incontinence, and dementia with Lucy Barylak, MSW. And I forgot to introduce you, Lucy, but here it is. So Lucy is our dear Lucy. She received her master's degree in social work from McGill University. She's dedicated her career to supporting caregivers. Lucy was the founder and long-term manager of the Caregiver Support Center at a respite program for family caregivers. In 2003 and 2012, she received the Queen's Jubilee Award presented by the Canadian Home Care Association for her dedication in developing a coalition, a national coalition to support caregivers and their issues. She's been a key architect of screening and assessment tools of family caregivers and providers, and she has taught professionals across North America. On a personal note, Lucy would like you to know that she was a caregiver for her own mother for about 10 years. And with that, Lucy, thank you so much for joining us today. Thank you for putting together your well-researched presentations, and especially on this topic, which is a tough one.
Thank you so much, Evelyn, and thank you everybody for joining us this morning. Just letting you know that I'm just getting over, I don't know if it's a cold or a flu, it's just lingering on. So if I have to take a sip of my tea, I hope you will allow me to do that. So as Evelyn said, today I will be speaking about a taboo subject, dementia and toileting, a subject that was identified to me by many caregivers who are caring for someone with dementia. Many of them were embarrassed to ask certain questions. So I'm going to share some of these questions that they had for me. So one of them was, wiping my husband after he uses the toilet is very difficult for me to perform. Am I a bad person? And another example, I really feel very embarrassed to tell my mother that she needs to wipe herself. It appears that she is embarrassed to do so in front of me. I know that if I don't watch her, she will not do the task, and I'm concerned about infection. How do I handle it? You know, today is an open discussion. No questions or remarks are problematic. The topic is very important and needs to be addressed. So the way I'm going to organize it today is I'm going to do my presentation, which will be a little bit shorter than usual because I want to leave enough time for questions that you can ask. And also, as Evelyn said, share some of the tips that have worked for you with other caregivers. All right. So let's go to the next slide, please. So here's the agenda. So I think it's so important that we review and understand dementia and toileting issues. It's really very different than anything else. And again, what causes toilet problems and incontinence? That means when someone cannot hold their bladder or their stool. What are the risks for someone who suffers from incontinence? And I'll also give you tips on how to manage incontinence. And one of the most important things is what caregivers need to do for themselves. So this is not only about incontinence and toileting, it's really important to keep in mind that caregivers themselves go through a very, very difficult time. You know, incontinence in people with dementia is one of the factors associated with the decision to move the person into a care home. Many caregivers tell me, I mean, that is it. I can't do this. Managing incontinence adds to the caregiver's burden and has been reported by family caregivers to be more difficult to manage than the behavioral symptoms of dementia. But it doesn't have to be so, okay? Many caregivers and their loved ones can remain at home with incontinence issues if the caregiver has the tools, information, education, and the ability to manage this issue in a way that maintains the person's dignity as well as the caregiver's satisfaction of caring for the person at home. If it's too much to handle, I have to say you should look into alternative placement and give yourself permission to find out about it, because as I said before, many caregivers feel that that is kind of the point where they can no longer continue. But let's look at the positive side of it and the negative side of it. You know, in general, caregiving can be very rewarding, and I know that from my own experience with my mother. but very challenging as well. And on top of it, to have to deal with this issue makes it even harder. Now, there's definitely an emotional side of caregiving that I think it's important to look at. And I saw a wonderful article by Dawn Shep, she's a nurse, and you will find it under resources in my last slide. It's good to look into it. What she really says is whether you become a caregiver gradually or all of a sudden due to a crisis, or whether you are caregiving willingly or by default, many emotions surface when you take on the job of caregiving. Some of these feelings happen right away, and some don't surface until you have been caregiving for a while. Whatever your situation, it's important to remember that you too are important. All of your emotions, good and bad, about caregiving are not only allowed but valued. Many feelings come up when you are caregiving for someone day in and day out. Many caregivers set out saying, this won't happen to me. I know, I love my mother, my father, my spouse, my sister, my brother. But after a while, the negative emotions that we tend to, to kind of come to the surface and start dealing with that. Caregivers are often reluctant to express those negative feelings for fear that they will be judged by others, or that you'll judge yourself, or they don't want to burden others. So today I'm giving you all permission to acknowledge your feelings. You're allowed to do so. So let's look at that. So here are some emotions that you may be feeling and too embarrassed to talk about or even share with anybody. So I just want to put them out there. You have a lot of ambivalence. There could be anger, anxiety, crankiness, irritability. You could be depressed. You could be sad. You could be disgusted. You could be embarrassed. There could be fear, frustration, grief, lack of the fact nobody really appreciates all the things that you do. You could be lonely. There's tremendous losses that you have, resentment, tiredness. And also there's other emotions that are more positive, that you love this person, you respect them, you want to do the best that you can for them. It's okay to feel some of these emotions. You're only human. I will elaborate more on how and what you need to do to manage your emotions in the later part of my discussion, because this is really important that all these factors come into play when you're dealing with this particular issue. Finally, with dealing with the issue of incontinence, it's important to rule out health reasons that may have little or nothing to do with dementia, okay? Difficulty going to the bathroom can be a sign of another medical problem, like a urinary tract infection, excuse me, dehydration, maybe poor eating habits, dietary things that are not drinking enough. For men, it could be prostate problems or side effects from medications. Now, that is important to keep in mind. For example, one of them, sleeping pills, for example, can cause incontinence. So it's important that you consult the person you're caring for, consult their doctor as soon as possible, especially if this is a new situation. It can be caused by a medical problem or by the medications that they're taking. And even if they've seen their doctor, let's say, and it's whatever is happening is increasing, I would suggest that you do that first and foremost. However, it is common for people to have difficulties using the toilet as they get older, particularly if they have dementia. So accidents and incontinence can cause problems, especially as the person's condition progresses. This can be very upsetting for the person with dementia and difficult when you're supporting them. So many people find it difficult to talk about these issues. However, support is available. With the right help and advice, we can hopefully manage some of these issues. So I'm really very happy that you're here with us today. At least it's a beginning of looking at that and not being embarrassed and dealing with it. So what do I mean by toileting? What is toileting? Really, toileting refers to the individual's ability to independently get to the toilet, use it properly, and clean themselves effectively. Although this is second nature for most people, dementia patients face a variety of challenges that interfere with their daily ability to use the toilet. There are several types of incontinence that have different underlying causes. Okay, it could be, as I said, medical or taking the wrong medication, but dementia patients typically experience their functional incontinence, primarily urinary and bowel movement, because of their dementia. But they experience a loss of bladder and control, as I said before, and because they really don't understand how to go to the bathroom and what you need to do in the bathroom once you're there. So let's go to the next slide, please. So let's look at what causes toilet problems and incontinence with people that have dementia. Remember that every individual with dementia is unique, and strategies that work for one person might not work for another. But it's so important to be flexible, adaptable, and compassion are crucial aspects of caregiving in this situation. You have to have an awful lot of patience, and that's not easy to do many times. So let's look at it. So we know that they have cognitive impairment. Dementia affects cognitive functioning, including the ability to recognize and respond to bodily cues. Individuals may not be able to recognize the sensation of needing to use the toilet. So obviously they're going to have an accident. Communication challenges, we know that as the dementia progresses, communication skills deteriorate. The person may have difficulty expressing their need to use the bathroom or understand instructions that you're giving them. They're not able to tell you, so there'll be an accident. Mobility issues need to be taken into consideration as well. Dementia can lead to physical limitations, making it challenging for individuals to reach the bathroom in time. Memory loss, we know that. Forgetfulness can cause individuals to forget where the bathroom is located, or to forget that what they need to and how to use it. So and then accidents can happen. We know that dementia, there's memory loss. Forgetfulness can cause individuals to forget where the bathroom is located, or to forget that they need to even use it. Now, this is another important one, sensory changes. Dementia can alter sensory perception, making it harder for individuals to recognize the sensation of a full bladder or a bowel. Their sight, their hearing might have been affected. So all that plays into that, and many times that's why accidents happen. And I talked about medication side effects. That's a very important one to check out. Some medications used to even manage dementia symptoms or other health conditions can affect bladder and bowel control. So many times talking to the doctor and recognizing that maybe a medication needs to be changed or decreased. Now, there's also physical health conditions, underlying health issues such as could be a urinary tract, could be constipation, whatever it is, can contribute to incontinence. Now, the person might have a lot of anxiety and stress. We know that people with dementia do. So changes in routine, unfamiliar environment, which may impact a person's ability to control their bladder and their bowel. Excuse me. They might be afraid of strangers. You might be in the mall and all of a sudden, they're seeing all these strange people, and for whatever reason, accidents happen. People with dementia also have a lack of awareness. People might not be aware of the consequences of their actions, leading to accidents, and don't understand, and they probably don't even understand why you're getting upset if you are getting upset. And there's the other thing, as people with dementia, there's many times loss of inhibitions. Dementia can lead to a loss of social inhibitions, causing some individuals to exhibit behavior they wouldn't have in the past, including inappropriate urination or defecation. Altered perceptions of time, a distortion sense of time can affect the individual's ability to wait for the appropriate time to use the toilet. They don't know if it's day or if it's night, These are all things that we need to take into consideration. As the dementia progresses, there can be increased deterioration. Even in family settings, they may tend to get confused more easily. You know, a senior with dementia may forget where the bathroom is located in their own home, what the toilet is for, and the steps needed to proper toileting. This can result in a dementia patient failing to go to the bathroom in time, struggles to remove and put on their clothes, urinating or defecating in places other than the toilet, and neglecting personal hygiene. Cognition and functional decline causes toileting problems to worsen throughout the mid stage of the disease, even with increased assistance and supervision. So we have to face, what I'm trying to say is that, and we know that as caregivers, and many times I have to say this to myself when I was a caregiver, we have to blame the disease and not the person. Because as I pointed out to you, of all these things that people with dementia go through and how difficult the basic task for all of us to go to the bathroom can be for them. So let's go to the next slide, please. So let's look at what are the risks of someone who suffers from incontinence, all right? It can pose several risks, and I would like to go through them a little bit more one by one. So obviously you need to be aware that there's skin issues. And prolonged exposure to urine or feces can lead to skin irritation, rashes, and even more serious condition like pressures, ulcers, which are really bed sores. That can, the constant use of moisture weakens the skin's protection layers, so it's important to change them as soon as possible. And that's why many caregivers, if their person is in a long-term care facilities, they can stay in a diaper for so long, and unfortunately, bed sores appear, and that's a medical problem. Now, the other thing is that urinary tract infection, incontinence can increase the risk. Bacteria present in urine can enter the urinary tract more easily when there's a leakage, leading to infection that can cause discomfort and require medical treatment. The other thing is there's a social isolation and embarrassment, all right? These are part of the risk of being incontinent, can cause embarrassment and anxiety, leading individuals to avoid social interaction and potentially isolating themselves from others and getting depressed. So even if the person is still living alone, you might find that all of a sudden they don't want to go anywhere. There is definitely a reduced quality of life, the physical discomfort, emotional stress, and limitations on daily activities that incontinence can cause may lead to a reduced overall quality of life, and they begin to isolate. Now, fall risks, that's another one. Frequent trips to the bathroom or the need to use mobility aids while rushing to the bathroom can increase the risk of falls, particularly in older adults. Now, there's a psychological impact. Incontinence can lead to feeling of shame, frustration, and loss of self-esteem. It may contribute to mental health issues such as depression and anxiety, and people can become very, very agitated. Now, compromised hygiene, I've been talking about that. Individuals may struggle to maintain proper hygiene due to the challenges of cleaning themselves after accidents and not doing a very good job at that. Dehydration now, some individuals reduce their fluid intake to maintain, not to have to go to the bathroom so often, which can lead to dehydration, and it's associated with health risks. And believe it or not, it actually increases. If you are dehydrated and elderly, you can become more forgetful and become more confused. So you have to keep an eye on that. Now, the other thing is sleep deprivation. Bedwetting can disrupt sleep patterns, leading to poor sleep and quality in the daytime. They're up, they're down, causes lots of problems. Cognitive and functional decline in individuals with dementia, the inability to recognize and respond. So we talked about that. Caregiver's burden, I do want to talk about it. Incontinence can be physically demanding and emotionally challenging for caregivers, potentially disrupting, disturbing to caregiver stress and burden and adding more work. Now, there's also a financial cost, purchasing products like adult briefs, bedpans, skincare supplies, additional medical treatments and interventions may incur costs. And then malnutrition, believe it or not, the need to rush to the bathroom or the embarrassment of incontinence can lead to skipping meals and not eating regularly. Many caregivers actually tell me that's a big issue, that people with dementia, elderly sort of kind of stop eating and drinking as they should. Let's go to the next slide, please. All right. So we're getting to the point of looking at tips, all right? Tips for caregivers. So I want to emphasize that like bathing and showering, difficulty using the toilet can be intimate and embarrassing and presents a real challenge for people with dementia and their caregivers. The best way to approach toileting problem for someone with dementia is to take the following steps towards an easier, less emotional experience. So first and foremost, set up the bathroom to make it as easy as possible for the person to get on and off the toilet. Having a raised toilet seat and bars is really important. Another thing, this was a tip from a caregiver. She put a picture of a toilet on the door of the toilet in a way to help her husband recognize that that door is for the toilet. And it might be something that would be helpful for you as well. Preventing toilet issues may be as simple as reminding your loved one to use the bathroom every 2 to 4 hours. An occasional prompt can get your loved one up and headed to the bathroom, and then it's a good idea to check that the toilet was used and that your loved one didn't get distracted or have an accident. Now let's talk about smart drinking, okay? Limit the amount of liquid your loved one drinks. So on one hand, I'm telling you, don't let them get dehydrated, right? And on the other hand, I'm telling you to limit it, but I'm talking about before bed to reduce the need for nighttime bathroom trips. Be careful again, not to dehydrate. However, as a dehydration can lead to problems, including headaches and all the things that I talked about before. Now, this is another one that's so important. Watch for signals. If your loved one is fidgeting, tagging clothes, especially the front of the pants, or generally agitated, this could be a sign that it's bathroom time. Or they're all of a sudden they're sitting, they're getting up, they're pacing, you're asking what's going on, what do you need? So these are a little bit of signals that maybe that's time to escort them to the bathroom. Be routine. What do I mean by that? Establish regular times of the day for bathroom breaks. You want your loved one going about, as I said, every 2 to 4 hours. Most people have bowel movements at a regularly at the same time. Most of the time it's in the morning. And encourage regularity is smart strategies. Establish routine is vital in most aspects of caregiving, and toileting is no exception. Don't rush. That's another one. Okay, don't rush them. Going to the bathroom might take a while. Walk away or step out of view and wait patiently for your loved one to finish. Remember, I said you need a lot of patience with this. And sit instead of stand for men. With dementia may need to sit when they urinate, especially in the late stages of dementia when balance and falling are a big issue. Be sensitive. Like with showering, needing to help with toilet can bring up feelings of embarrassment and loss of dignity. Some people find incontinence demeaning. Respect this and don't appear upset if you have to deal with an accident. Please don't shout or don't embarrass them. Even your body language can tell them a lot, even if they don't understand. And again, act fast. Respond quickly to accidents because they can cause skin irritation and discomfort. And obviously, as soon as possible, clean them up so that there won't be the possibility of bed sores. There is no quick fix. It's difficult and it's a great burden on caregivers.
Hmm.
Let's go to the next slide, please. So having said that, giving you tips, and we'll talk about it a little bit more. There's an emotional impact on caregivers, and it's very, very important that you recognize it, okay? I can very well imagine what caregivers are going through. They may face several difficulties when dealing with toilet problems and incontinence. It's very important. It's very important that you need to deal with that. But what I do want to say, and I always say that there's two people in this relationship. One does not outweigh the other. You need to take care of yourself in order to continue caring in any way that you are at this point. So caregivers may feel frustrated, as I said, you can be embarrassed. All these things are normal feelings. Communication challenges, figuring out whether the person needs to use the bathroom and helping them understand instructions can be testing due to the communication barriers caused by the dementia. Now there's their privacy and dignity, balancing the need to assist with toileting while respecting the person's privacy and dignity can be challenging. What if they don't want your help? And what if they feel that they don't, that they know how to wipe themselves properly? There's also personal hygiene, ensuring proper hygiene after accidents or helping with bathroom tasks can be physically demanding and emotionally. You might even feel somewhat disgusted. It's not a pleasant thing to do. So then caregiver stress comes in. The constant vigilance requires a lot of patience, time management, the need for frequent bathroom breaks and assistance can disrupt your daily activities. So you might not even want to leave them alone. And so you kind of start to isolate yourself. And the other thing is coping with the behavior changes. Behavior symptoms worsen during toileting, leading to challenging. Maybe they get upset with you and you get upset with them. Physical demands, assisting with transfer and maneuvering in tight spaces and managing equipment like a motor, bedpans can be physically demanding. And you have to ask yourself, am I able to do that? Finding appropriate solutions, identifying the right products that you need. There's an impact on the relationship, which is a huge impact. Caring for someone with dementia and managing toilet issues can strain family relationships and affect the caregiver's own well-being. Even if you're partners or if you're if you're a daughter caring for a father, it's a very delicate situation. So if you're feeling frustrated, angry, embarrassed, all the things that I talked about, please acknowledge them. Your feelings are very valid, but it's important that you acknowledge where you're at and what's going on in your life at that time. So if you find yourself in this situation, you may be stressed and overwhelmed. Let's go to the next slide. Now, many times, we talk about signs of stress. What are signs of stress? And there can be any one of these, and you don't have to feel them all. Even if you're feeling one or two, it's enough. Feeling burdened or worrying all the time, feeling tired often, sleeping too much or not enough, gaining or losing weight, becoming easily irked and angry, losing interest in activities you used to enjoy, feeling sad, having frequent headaches or other pains in your body, misusing alcohol or drugs, including prescription medication or even over-the-counter medication, missing your own medical appointments. Okay, these are signs that you are stressed. Too much stress over time can harm your health. As caregivers, you might feel depressed or anxious. You might not get enough sleep or physical activity, or you might not eat proper meals. All of these increases your risk of health conditions such as heart disease and diabetes. Let's go to the next slide, please. So how do you manage your stress? One of the most important things is ask for and accept help from people that you trust. Make a list of ways in which others can help you. Then let them choose how to help. Ideally, include regular walks with the person you care for. Maybe they can cook a meal for you and the person that you're caring for, and helping with medical appointments. Focus on what you can do. At times you might feel that you're not doing enough, but no one is perfect. There's no perfect caregiver. Believe that you're doing the best that you can. Set goals you can reach. Break large tasks into small steps that you can do one at a time. Make a list of what's important. Follow a daily routine. Say no to requests that anyone is requesting of you that would be draining for you. Learn to say no. Get connected. Learn about caregiving resources in your area. That it could be classes that you can take. You might find caregiving services that are available that you didn't know about. It's also important to join a support group. People in support groups know what you're dealing with, and they could be very, very supportive to you. Seek social support. Please stay connected with the people that you know. Don't isolate yourself. Take care of your health. Find ways to sleep better, exercise a little bit more, and eat well. See your healthcare professional. And if you believe in it, get the right vaccines you need and regular health checkups and screening. Tell your healthcare professional that you're a caregiver. Talk about worries or symptoms. However, if all of these fails, you need to recognize it may be a time to have some changes in your life. So if we go to the next slide, these are resources that if you get these resources, you can actually just click on where the blue is, and you can go to some of these wonderful articles that are part of this presentation. So I'm looking at the time, and as I said, I want to leave lots of time for questions. So let's stop talking. Let's start talking and sharing. So maybe we can go to the first slide and open it up for discussion. Now, I know that I said an awful lot to you, so there might be questions that you want to review and maybe share your own experience, and I'm very open to do that. And so let's start having a good conversation.
So folks, if you're on Zoom, please unmute yourself or put your hand up, or what's the other thing? Go to the chat room. And if you're on your phone, I have a website that will tell me that you have opened your phone up by pressing *6. So please join us. Lucy has said a lot. She went a little bit quicker than usual because she was trying to give you the whole picture to get you to ask questions or to make comments or even suggestions about how you have handled things in the past, what worked for you or what didn't work for you. So we would love to hear from you. And now's a good time.
Sometimes it takes a little bit of time for people.
Yes.
Formulate your questions. Now yes, go ahead.
I actually wanted to share something that I just went through with my mother. She had an abscess and was in the hospital for a time, and they showed her about these wipes to use to clean herself whenever she went to the bathroom afterwards. And I was like, okay, that's new. I didn't know about these wipes, and some are flushable and some aren't, but it is a way to help them continue to be independent and making sure that they are still doing a good job.
Thank you very much for that. Yes. Wipes are, and some of them are flushable and some are not. So if they say they're not flushable, don't throw them in the toilet. You'll block up your whole toilet. Yes, so these are good. It's a very good tip. The reason that I didn't mention it when I did it is because I think it's really. Remember when I said that the first thing you should do is go to the doctor if you haven't been there for a while, because there's many reasons why people become incontinent of stool or urine. It could be medical. But wipes also, there are side effects to everything, but I think wipes are a good idea. And I'm wondering if anybody else uses them and you want to share with us. But thank you for that.
Now's the time, folks. Weigh in here.
Hi, I'm Michelle.
Hi. Hi,
My husband is in an assisted living place, and I have used those wipes often because I go there just about every day, and I make sure after he goes to the bathroom that he leans forward and I can check his back end to make sure that everything's been cleared out. I can usually smell it. So, but God, on goes my rubber glove and I get those wipes. He would be confused to be able to use them, but just to know that I can. And then I have to watch out because he can develop a rash in his groin by his testicles. So I'm gonna have to make sure I clean that because all staff is so low and turnover is great in these assisted living places. So I just try to keep him as clean as possible. So without pass.
I so thank you for sharing such an intimate experience. And this is why I wanted to have the opportunity for people to talk about it. It shouldn't be as taboo as it is. It's no different than anything else that we as human beings do by eating, by sleeping, by walking, by talking. This is a normal, and so we need to normalize it and not be ashamed of it. And in the way you described it was so sensitive and so dignified. So I thank you for that, Michelle.
Anybody else? Melody?
Yes, hi, I'm Melody and I'm grateful to be here. Thank you so much. I am caring for my husband and have been doing so at home for about 6.5 years after an Alzheimer's diagnosis. And we're in the incontinent phase now, the last phase. I did find a product on our grocery store shelf that was next to the Windex. It was a spray bottle specifically for urine. And I'm somewhat of a clean freak, and I find some comfort in at least being able to spray down the toilet and the floor quickly after my husband goes to the restroom. He has trouble getting there on time. So I appreciate the 2 to 4 hours idea of toileting reminders. So, and I appreciate this seminar very much because I'm in new territory. I'm interested in the earlier commenter because I have thought in my mind, maybe it's time to think about placing him somewhere because this incontinency is tough, and I know buildings are short staffed. So if you're still doing it, when you go see your loved one in an independent living setting or an assisted living setting, I don't know. I'm just talking out loud about, is it time to place or not? And there's no perfect place. And so this is hard, and I'll just leave it at that.
No, thank you so
Sorry.
much for bringing that up. Okay, that's an issue that a lot of caregivers deal with. Oh, you left us for a minute, Melody. Okay. It's very hard to make that decision. It's a very individual decision. Yes, they are short-staffed in long-term care. Okay, they are short-staffed. But what benefits does it give you apart from that task? You're still doing that task. But then maybe you can, go home and have a rest or meet up with family and friends at the times when you're not there. So there's pros and cons to everything. And so it's a very individual place to be with. And that's why caregivers need to have the opportunity to voice all this and to really talk. Because remember what I said, it's not just about the person. I'm concerned about you. I'm concerned, what is your life? What has changed in your life right now? What is it that you cannot do? So for some people, they want to keep the person as long as possible at home. That's why I talk so much about stress for caregivers. But you have to analyze it. What is it doing to me by keeping and I'm not saying that people should be placed. That's not what I'm talking about. If you can manage at home, it's great. But be honest with yourself. What has it done to my life? You look like it's fairly important to me. All of you do. You know, your life is, you deserve to have a life.
Mhm.
Things that you enjoyed. Have you given up any hobbies that you did, that you had before? What have you given up? So again, it's a process and you're at the beginning stage. But the fact that you joined is the beginning of getting some support and help and really being able to talk about it.
Thank you. I
So
appreciate that. We're just to clarify, we're actually at the end stages and on hospice care. So we'll see how this shakes out. And I think this is very helpful. Thank you so much.
Thank you. Nina's been waiting a while.
sorry?
Nina, go ahead.
Can you hear me okay?
Yes.
Yes.
My husband has advanced Parkinson's, so let me just close the door. Be right back.
Sure.
In the meantime, LJ put in the chat, bidets can be very helpful. They are available via retail and easy to install without a plumber.
I'll get back to you on that because I didn't quite hear it. Go ahead, Nina.
I was just going to say my husband is at he has a very advanced Parkinson's at this point, so we're having those and some dementia. So we're having those problems too. And I don't really have a question, just want to kind of echo what Michelle said. I just hate this part. It's one of the worst parts because at this point we have like great wipes. And so I'm using them, but when I have to clean him after a number two, it's awful for me and him. I know he feels really bad too. It's awful for us. It's terrible. And um, just something I want to add too, we're lucky enough to be able to have some caregivers come to the house to help sometimes. And they are so knowledgeable about what products to buy. They've just really helped from like bed, like pads to put under the beds, which are amazing because they know brands and like the best ones and the wipes, these specific wipes that we get. And it's true what you said, Lucy, too. The very important is to have coincidentally, our toilet broke. We needed a new toilet. We got a high one with some rails on the side, and that was a game changer.
Mm.
Thank you so much, Nina. I mean, the fact that you're able to even acknowledge, listen, we have to be real. Wiping someone's behind and the smell that goes with it is not something that is pleasant. And the fact that we're able to talk about it and acknowledge it amongst us, and to see that you're not alone in that. It's normal to feel this way. And when you said your husband again, they know, I mean, depends on where the disease is at, obviously, the embarrassment about it, but just the ability. And so I guess what I'm trying to say is this is a good kind of a place to be able to see that you're not alone in this. You're not.
Yeah, thank you.
You're welcome.
Kathy, you had your phone open for a while. Did you want to comment? Kathy Hartle?
Kathy? We're not putting you on the spot or anything. Can you hear us? No, her mic is off. She has to unmute you. Oh, Kathy's here. Okay, there was another Kathy. Yes, go ahead, Kathy.
Oh, okay. Anyway, we also got a bidet and that does help. And I totally agree with those of you who say this toileting thing is very, very challenging. And consequently, I'm more tied to home too, because I don't want anyone else have to deal with it. We have just come south for 2 months. And oh my gosh, what a difference this year with planning for all of that. I had I had a whole big container just with toileting supplies that I brought, not to mention what I'm getting shipped here. But this will be our last time mainly because of that and the mobility. My husband has Lewy body dementia, and so we've been dealing with toileting things for a couple of years at least. He's even had prostate surgery, and that seemed to work for a little bit, but then stopped working. So it's I'm catheterizing him twice a day at least, and I have found if he's had a BM and it's messy, and the day doesn't take care of it, that just putting him in the shower, putting a plastic glove on, and cleaning him up is the best way to go. It is spraying him off, all of that sort of stuff. So, but it also keeps his daughter, for example, from feeling like she can take him, because she can't imagine doing that. You know how that goes with probably all of you have had that sort of experience. It's challenging.
Remember, I said one of the hardest things is how it affects the relationships.
Yeah.
It definitely does. May I ask you a question?
Sure.
A little personal. How are you managing, Kathy? How has it changed for you, your life?
Oh my gosh, the stress in particular is really difficult, and a certain amount of isolation, although at home we have an adult daycare program that he really enjoys. And we just got down here, so tomorrow I'm going to start looking at local ones to see if there's something that I can even get away one day a week. Because that has been a total game changer for me, is having regular times, stretches of times that I can get away. Get away meaning doing errands, getting grocery shopping, doctor appointments, a massage sometimes helps too. But doing those things that either need to be done or that getting together with a friend, because otherwise it is very isolating.
And I want to tell you, that's one of the things that I'm so concerned about caregivers.
Yeah.
Whether if we're lucky enough to have been born with good mental health, but we're dealing with situations like that and having stress, we have to be so cautious about it. And I'm sharing with you as well. I mean, I was in the field myself, and when I found myself to be, that's my ongoing cold. When I found myself to be stressed, I really reached out to get the help, because before you know it, it's like it creeps up on you, and out of nowhere that depression can set in.
Right.
So strongly. And then what good are we to ourselves and to anybody else? So
I found myself tearing up when some of the others were talking, so it tells you that there's definitely stress going on.
there you go. I mean, just the fact that you could be empathetic to each other tells you that you're a little bit vulnerable. So my emphasis is to identify it, acknowledge it, and get the help that you need.
Yeah.
And again, going back to, someone being placed, that's all part of that, because in a caregiver journey, and I'm going to emphasize this over and over again, because I went through this myself. It's not just about the person that's ill. It's about the other person as well who's caring for that person. You have a responsibility to yourself to keep yourself healthy, to keep yourself well. You deserve it. Because in the research that I have done throughout many, many years of being in the field, over 30 years, and always concentrating on caregiving right from the beginning when I started being a frontline social worker, a manager, a researcher, it didn't matter, is the fact that caregivers need to give themselves permission to care for themselves and have a life.
You know, one of the things that I have said to my husband a few times is that we want him to stay at home as long as it's safe. I used to say as long as he's safe, but I've changed that to as long as it's safe, because I need to be safe too.
100%. Yes, 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 kudos to that. Yes, and I want to tell you something, when someone is very stressed and very burdened, you can do things that you would never do before by yelling, by shaking the person.
Oh, right.
Very, very angry. Okay,
Mhm.
what happens? You feel so guilty. I'm such a terrible person. So all that plays into it. That's why it's so important to be able to have these kind of conversations.
Yeah.
And everything that you're saying, I'm sure each and every one that's listening has felt at one point, including myself.
Yes. We got 6 or 7 chats. Lucy, you want me to read them to you?
Okay.
Okay, from LH, recommendations for reliable, washable, and 100% waterproof furniture protectors. Wraparound bed protectors where mattress is fully covered on all sides, not just on the top. Websites I've looked online, and often they are pet protectors or they are advertised as waterproof, but they are not. Anybody have suggestions?
Never, I didn't even bring that one up, but there you go. That's why it's so important to listen to others. Yeah. Okay, what else was on the chat?
Okay. Kathy said we also installed a bidet. Okay, I think we talked about that. Darlene said, what is the name of the product she mentioned to spray on the floor and toilet?
All right, so I think that was Melody. Are you still with us?
It's actually, I posted a picture of it on the chat.
You're so good, Minerva. Thank you.
That LH raised her hand. Who is LH or their hand?
Hi there. It's me. I just asked the question about furniture protectors. Do you have anything off the top of your head that you could tell me now?
I don't.
Or no, you have no suggestions. Okay, thank you.
I mean, go ahead. Go ahead, Evelyn, if you have any thoughts on that.
Yeah, my grandson was a bedwetter, and his mom managed to find, it was a plastic that went over the entire queen mattress, and it worked. And I'll have to do some research and see if I can find out where she got it, but I believe it was from the mattress company. One of the mattress stores locally. Yeah. So just want to tell you he's
Okay,
13
thanks.
now, but he doesn't go to his bed anymore. All right. We also
In the olden days, when I was a child, I remember my aunt used to have a sofa in the living room, and it came covered in plastic, and she kept it covered in plastic always. I'm sure there must be something out there. I guess it's just doing a little bit more research. Yeah.
we had a recommendation from LJ, I believe, to everyone. Use Vicks under your nose to help fight the smell. Very practical.
Vicks is powerful. No, that's an idea, if it works.
And Minerva's picture says that it is Clorox urine remover.
Okay, Clorox. Okay.
All right, and that's just what Melody said she got to.
Okay.
Katie said thank you. LJ said thumbs up. The label on that Clorox bottle is yellow, imagine that. And the label says it works on hard and soft surfaces. The label also says it eliminates stains and odors. Thank you for that. LH says, okay, thank you. And Jill sent us a website. Jill, what's the website for? Can you tell us? Jill, are you still with us?
She
Go
said,
ahead.
I just ordered this mattress protector and I plan to put it under a cloth mattress pad. It's a link to a Walmart mattress protector that she just ordered.
Ah, okay.
We're getting somewhere.
All right. I think we have all of them. Anybody else? Actually, it's about 2 minutes to the hour. I've got a little bit of housekeeping to do, so I'll do it real quick and we'll see if anybody, has anything else they need from you, Lucy, or from each other, I should say. There's your session survey. Please feel free to, take the time to fill that out. If you were not registered for today, if someone just gave you the link or the number to call, please register so that you get all that get the resource page, because it's really, Lucy works really hard to do the research to find out what the state of the art is in caring for caregivers who are caring for people with dementia and toileting issues. So please call our WellMed Charitable Foundation customer service representative, the dear Minerva, who's excellent, at 866-390-6491. That's 866-390-6491, and get registered, because with that registry, you will also get the monthly calendar, which will tell you about what's coming up. And the sessions we have coming up this month are quite a variety. Next Monday, we have depression and anxiety in family caregivers and older adults. On Tuesday, the day after that, we have a Spanish session, a guide on how to live with Alzheimer's disease with Nestor Pradario, who is an amazing geropsychiatrist. And we have on the 21st, how to handle caregiver self-doubts and low self-esteem. And I think, most of the people on here probably have felt some of that at times. So that should be a really good one. And then the last one on January 28th, Aging Issues and the Law. And this is especially, it's ESPL, I don't know what that stands for, and probate with a little Medicaid information. And that's with an attorney. So we've got some really good stuff lined up for you. I hope so much that you all have a great new year. And there is no perfect time for placement. And the perfect time to express your emotions is when you have them. Reacting may be different, but expressing them is always good. And I'm just saying this as a social worker who's been around probably longer than Lucy. That way we have a little challenge here now. Anyway, thank you all so much for what you do every day. And thank you for your comments today. This has been a pretty priceless podcast. Please encourage your family, friends, daughters, whoever's involved in the situation as part of the caregiver team, to take advantage of all of the good information on this session. And Lucy, I can't thank you enough. You always do such a caring job and such a wonderful, researched presentation, and give us the best scoop. And we really appreciate it. And I also want to thank the WellMed Charitable Foundation for all that they do to support caregivers in the community and to try to get them the education and information that they need. And with that, I am going to.
I would like to say something before.
Sorry.
Oh, that's okay. I cannot tell you how much I admire each and every one of you. And I bless you and I wish you a very, very good new year. And just keep one thing in mind. You are important. And you deserve a good life. Take care.
Thank you, Lucy. Goodbye, everyone. And thank you so much for joining us today. I'm going to stop the recording at this point.
Thank you.
Yes. Bye-bye, everybody.